Otitis media is a common ear infection, especially in children. It is one of the most frequent reasons parents bring their children to the doctor. This condition can be quite distressing for both the child and the parents, as it often causes significant discomfort and pain. Understanding what otitis media is and how it affects the ear can help in managing and preventing it. It happens when the middle ear, the space behind the eardrum, gets inflamed or infected. The middle ear is a small, air-filled cavity that contains tiny vibrating bones essential for hearing. When this area becomes inflamed, it can disrupt normal hearing and cause a variety of symptoms. This can cause pain, fever, and even hearing problems. The pain is often due to the pressure from the fluid buildup in the middle ear. Fever is a common response to infection, and hearing problems can occur if the fluid interferes with the movement of the eardrum and the tiny bones in the middle ear. There are different types of otitis media, but the most common is acute otitis media, a sudden infection that often follows a cold. Acute otitis media can develop rapidly and is usually accompanied by symptoms such as ear pain, fever, and irritability in children. It is important to seek medical attention if these symptoms are observed. Otitis media can affect anyone, but it's most prevalent in infants and young children. This is because their immune systems are still developing, making them more susceptible to infections. Additionally, young children are more likely to get colds, which can lead to otitis media. This is because their eustachian tubes, which connect the middle ear to the back of the throat, are shorter and more horizontal. The eustachian tubes help to equalize pressure and drain fluid from the middle ear. In young children, these tubes are not fully developed, making it easier for fluids and germs to get trapped. This makes it easier for fluids and germs to get trapped, leading to infection. When the eustachian tubes are blocked, fluid can build up in the middle ear, creating an environment where bacteria and viruses can thrive. This can result in repeated episodes of otitis media, which may require medical treatment to resolve. Children are more prone to otitis media due to their developing immune systems, which are not yet fully equipped to fend off infections. This makes them more vulnerable to various illnesses, including ear infections. The anatomy of their ears also plays a significant role. In children, the eustachian tubes, which are responsible for draining fluid and equalizing pressure in the middle ear, are shorter and more horizontal than those of adults. This anatomical difference can cause fluid to build up more easily, creating an ideal environment for bacteria and viruses to thrive. Their eustachian tubes, responsible for draining fluid and equalizing pressure in the middle ear, are shorter and more horizontal than those of adults. This makes it easier for bacteria and viruses to travel from the back of the throat to the middle ear, leading to infections. This anatomical feature, combined with their developing immune systems, makes it easier for bacteria and viruses to travel from the back of the throat to the middle ear. When these pathogens reach the middle ear, they can cause inflammation and infection, leading to the painful symptoms associated with otitis media. Furthermore, children's immune systems are still maturing, making them more susceptible to infections in general. Their bodies are in the process of learning how to fight off various pathogens, which means they don't yet have the same level of immunity that adults do. This is why children often experience more frequent colds, ear infections, and other illnesses. Exposure to other children in daycare or school settings also increases their risk of contracting viruses and bacteria that can lead to ear infections. In these environments, children are in close contact with one another, which facilitates the spread of germs. Sharing toys, touching surfaces, and even close interactions during playtime can all contribute to the transmission of infectious agents. This communal aspect of childhood is another reason why ear infections are so common among young children. Teaching children good hygiene practices such as regular hand washing and using hand sanitizer can help reduce the spread of infections. Parents and caregivers play a crucial role in educating children about these practices and ensuring they are followed, especially in group settings like schools and daycares. Vaccinations also play a vital role in protecting children from certain types of infections that can lead to ear problems. Ensuring that children are up to date with their vaccinations can help reduce the incidence of ear infections and other related illnesses. Regular checkups with a pediatrician can help monitor a child's ear health and catch any potential issues early. Early intervention and treatment can prevent complications and ensure that children remain healthy and happy. Ear pain is one of the most noticeable symptoms of otitis media in children. They may tug or pull at their ears, cry more than usual, or have difficulty sleeping. Fever is another common symptom, often accompanied by fussiness and irritability. In infants and toddlers who cannot yet verbalize their discomfort, look for changes in behavior such as increased crying, difficulty sleeping, and refusing to lie down. They may also have a runny nose, cough, or decreased appetite. While ear pain is a primary symptom, otitis media can manifest in other ways. It's important to recognize these additional indicators to ensure timely and effective treatment. Fluid buildup in the middle ear can cause a feeling of fullness or pressure, leading to muffled hearing or a popping sensation. This sensation can be quite uncomfortable and may interfere with daily activities such as listening to conversations or enjoying music. This can be particularly concerning in young children who are still developing language skills. They might not be able to express their discomfort clearly, leading to frustration and behavioral changes. Parents should be vigilant for signs such as a child frequently tugging at their ears or showing reluctance to engage in activities they usually enjoy. In some cases, the eardrum may rupture due to pressure from fluid buildup. This rupture can be sudden and may cause a sharp pain, followed by a noticeable decrease in ear pressure. This can result in drainage from the ear, often yellowish or bloody, and a temporary relief from pain. The drainage is a sign that the fluid has found an escape route which can alleviate the pressure and discomfort. However, it is crucial to seek medical attention to prevent any potential infections or complications. While alarming, a ruptured eardrum usually heals on its own within a few days. During the healing process, it's important to keep the ear dry and avoid inserting any objects into the ear canal. Follow-up with a healthcare provider can ensure that the ear is healing properly and that there are no further issues. Section 5. Seeking medical attention. When to see a doctor. It's crucial to seek medical attention if you suspect your child has an ear infection. Early diagnosis and treatment can prevent complications and ensure proper healing. Consult a healthcare professional if your child experiences ear pain, fever, drainage from the ear, or any concerning symptoms. Don't attempt to self-treat or wait for symptoms to resolve on their own. Delaying medical care can lead to prolonged discomfort, hearing problems, and other complications. A healthcare provider can accurately diagnose the infection and recommend the most appropriate treatment. Section 6. Diagnosis, tools and techniques. Doctors use a variety of tools and techniques to diagnose otitis media. A visual examination of the ear using an otoscope allows them to assess the eardrum's appearance, looking for redness, bulging, or fluid behind it. In some cases, a pneumatic otoscope, which puffs air into the ear canal, is used to check for eardrum mobility. A stiff eardrum can indicate fluid buildup or infection. Tympanometry, a test that measures eardrum movement in response to sound waves, may also be performed to assess middle ear function. Section 7. Treatment options. Addressing the infection. Treatment for otitis media depends on the severity of the infection and the child's age. For mild cases, watchful waiting may be recommended, allowing the body's immune system to fight off the infection on its own. Over-the-counter pain relievers can help manage discomfort. If the infection is bacterial, antibiotics may be prescribed. It's essential to complete the entire course of antibiotics as directed, even if symptoms improve, to ensure complete eradication of the infection. Section 8. Surgical intervention, when it's necessary. In some cases, surgical intervention may be necessary to treat recurrent or persistent otitis media. A myringotomy, a minor surgical procedure, involves making a small incision in the eardrum to drain fluid and relieve pressure. Tympanostomy tubes, tiny tubes inserted into the eardrum, may be recommended for children with chronic otitis media. These tubes allow for ventilation and drainage of the middle ear, preventing fluid buildup and reducing the risk of future infections. Section 9. Prevention and long-term care. While not all ear infections are preventable, certain measures can reduce the risk. These include practicing good hygiene, such as frequent hand washing, avoiding exposure to sick individuals, and ensuring children are up to date on their vaccinations, including the pneumococcal vaccine. Regular checkups with a healthcare provider are crucial for monitoring ear health and addressing any concerns promptly. Early detection and treatment of ear infections can prevent complications and promote long-term hearing health.